Hi, I'm Dr. Robert Dean with ARO, and I'm here to talk a little bit about what you should expect after having a total knee replacement surgery. So total knee replacement surgery is a hospital-based surgery, and essentially what they're doing is they're opening up your whole joint. It's about a 10-inch incision, flipping over your kneecap, and they're cutting out both ends of the bone where the hyaline cartilage has been compromised from chondromalacia, which are little worn out or divot potholes. As they cut out those ends, they implant or glue in a titanium and a Teflon hinge from Stryker or DePuy, one of the different implant companies that make this. And then they flip the kneecap back over, staple the incision, and voila, your surgery is done. It's not that simple. This takes a few hours, and of course there's a certain level of expertise the surgeon must have as far as picking the right implant. And of course this is done in a hospital because it is a large surgery, so there's risks of anesthesia, infection, so on and so forth. But after all that, what do? There's rehab, right? There's therapy. So you have incisional healing, the wound has to heal. You know, the tissue inside of the joint that has been cut and replaced has to heal. And then the muscles and ligaments. Remember, depending on how fit or how weak you were prior to having this knee replacement, all they're doing is replacing the hinge of the joint where the nerve endings have been compromised. Everything else that might be causing you pain, weakness in your quadricep muscles and your hamstrings, the different muscles that help move your knee around, those aren't going away. You have to work hard at rehabilitating, strengthening, working them, and you have to work hard at making sure that that implant articulates to 180 degrees or 0 degrees or straight. And that takes time, that takes work. Most of the orthopedic studies that look at function, pain, improvement after replacement surgery, they wait 6 months to look and see what someone's new baseline is going to be. And a significant percentage of people that have this surgery, even if everything goes perfectly, end up with chronic pain that requires interventional and non-interventional pain management for the life of that joint. At AROmotion, we have minimally invasive procedures to help you with knee pain so that you could avoid a large joint replacement surgery if you qualify. To learn more about what we do here at AROmotion, feel free to call or email us to schedule a consultation.